morning.
Good morning.
Morning, Paul. Morning, Heather. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Thank you. So welcome to our weekly Friday briefing on the COVID-19 response. Today we have with us, as is customary, County Executive Armin Beauties, also with Dr. Heidi Gullett, our Medical Director, and our Co-Director of Prevention and Wellness, Ramona Brazil. And so with that, I'd like to start off by giving the podium to Executive Beauties. Thank you.
Good morning, everybody. I am, again, happy to be with all of you as we head into this holiday weekend. Thanks, as always, to Terry Allen and Dr. Heidi Gullett for hosting these briefings and for the great work that they continue to do. I just want to add, I sincerely hope that Terry and Heidi, that you get to take a little break this weekend. I know that you guys work so hard. I mean, nights and weekends, you're always out there working, and you know, I'm worried about your health because you got to stay healthy to help the rest of us stay healthy. And so take a little break this weekend, please. Speaking of health, I want to first talk about the executive order that I signed earlier this week. This order states that all county employees and people entering our county buildings must wear a face mask. While our buildings are not yet open to the public, they will be soon. We're working on an opening strategy, and the wearing of face coverings is a big part of that. Even now, we have employees in our buildings doing the work that needs to get done to get our services out to the public. They need to know that they're in a safe working environment, and the public needs to know that they're coming into a building that they can be safe as well. Wearing a face mask, it keeps the people around you safe. It doesn't keep you safe from contracting, from getting COVID, but it does help you to protect others from getting the virus. And if we all wear face masks, then we can all be safe and protect one another. So that's the goal. That brings me to this weekend. I'm sure that Terry's going to talk more detail about this, but I want to emphasize the same sort of thing as well. People are getting tired of social distancing. I know, I can see it in the public. And people are very much wanting to have everything go back to the way it was before. We're heading into a holiday weekend, and the weather is warmer. Hopefully, we may even get a day or two without rain. And that means we're going to want to get together and gather together and be with other people. That's natural. We want to be close to people that we care about. The governor has loosened up a lot of the restrictions. But here's the thing. The virus hasn't gone away. It's still there. And people can still be infected and can still spread the virus without even having any symptoms, without even knowing that they have the virus themselves. So even if you feel great this weekend, you need to continue to practice social distancing, please, hand washing, sanitizing, all the things that we've been talking about that this Board of Health has put out as guidance. It's very, very important. If we don't follow these practices, I'm pretty sure we'll be standing here in a couple weeks and there will be a spike. It's happened in other places. Why would Cuyahoga County be any different? So please, please be considerate of each other and be careful. Okay, now I'll get off my soapbox, literally. I want to give you an update on the distribution of PPE, personal protective equipment, that the county's been doing. Our PPE program is all about keeping our first responders and healthcare workers safe. And that's critical because they're helping keep us safe. Yesterday we hit a milestone. We filled more than 1,000 resource requests and have eclipsed the 1 million mark for PPE distributed. That's 1 million face masks and gloves and gowns and other protective items. It's a lot of PPE. I can't say enough about the great work that's been done between our emergency management department and this Board of Health on this matter. I want to say that a significant number of these PPE came about because of the generous and concerned county residents that have made contributions, dentists and veterinarians and local companies in the area that have contributed PPE. We actually got PPE from 3 different sources. One is the donations, another is the strategic national stockpile, and the third is the items that we purchased as a county government. We searched for and found and purchased as a county government. We've been aggressive from day one on this issue because we knew that there just wasn't going to be enough PPE available here and elsewhere to keep our first responders and healthcare providers safe. I authorized $2 million for the purchase of PPE early on and have pledged to do more as the need arises. I don't know of any county or city anywhere in the country that's done more in gathering, locating, and distributing PPE than Cuyahoga County. This PPE has gone to first responders, corrections facilities, hospitals, healthcare providers like nursing homes and assisted living facilities, alcohol, drug addiction, mental health service providers, cities, municipalities, and courts. This is an important demonstration of how good our emergency management department is that's getting things done. We should all feel comfort knowing that Cuyahoga County continues to be a leader in our state in emergency management. In fact, we're the only local emergency management accredited program in the state of Ohio. This is a worldwide accreditation which sets out standards, assessment, and accreditation for disaster preparedness programs throughout the country. As this crisis unfolds and we experience hotspots and different peaks, our EMA will be there processing requests to ensure the safety and well-being of everyone. Another area where we're devoting our attention is scams. Unfortunately, when there's a crisis, scammers will try and take advantage of the fear and concern that people feel. Our Department of Consumer Affairs is always vigilant, trying to make sure that they're on top of whatever the latest scams are, people that are trying to take advantage of our residents. And they've been very, very busy, those scammers, during COVID. This week, in cooperation with the County Board of Health and our County Emergency Management Department, the Cuyahoga County Department of Consumer Affairs put out a preemptive warning about COVID-19 contact tracing scams. Now, you've heard about contact tracing or tracking here from the Board of Health and how important that is. The Board of Health for the county and the city are very involved with contact tracing. They call residents that may have come into contact with someone who has COVID-19. It's a critical part of the response to the COVID crisis. These calls collect important information about the spread of the virus in our community. It allows the boards of health to locate people who have come into contact with someone who's positive so that these people can isolate themselves or be isolated. This is a necessary procedure to stop the spread. But scammers in some places have posed as COVID-19 contact tracers in an attempt to get Social Security numbers or bank account numbers. So we issued an alert to help our residents avoid these scams. Legitimate health department contact tracers will never ask people for their Social Security numbers, banking information, or for money. They will never ask for those things. Don't click on links or respond to texts that say you were exposed to COVID-19. If you're aware of any suspicious calls or texts, you can report them directly to the County Department of Consumer Affairs. The telephone number is 216-443-SCAM, S-C-A-M. And I'm pleased to say, by the way, Director of Consumer Affairs for the county, Cheryl Harris, is here today, and she's been on top of the scam squad. She created the county scam squad, and has it's been very active in making sure we're protecting our residents. Thank you, Cheryl. We keep a coronavirus scam page up through the Cuyahoga County Department of Consumer Affairs to help residents and others to find information about scams, all kinds of scams, all in one place. Residents will find tips on how to spot and avoid job scams, suspicious texts, stimulus scams that also exist. Businesses will find resources for boosting their cybersecurity and guarding against sophisticated email scams. We've gone a long way from the prince in Nigeria that wants your money. These scammers are very focused on getting at your personal information and your money. They're constantly thinking of new ways to get to you. So I encourage you to visit consumeraffairs.cuyahogacounty.us. That's consumeraffairs.cuyahogacounty.us to see the latest updates. You can also report scams at that same website, or you can call 216-443-SCAM. That's 216-443-7226. We're always looking for ways to increase awareness of scams. That's the best protection that people have, if they know what to watch out for. More than 19,000 Cuyahoga County residents will receive scam information in meals that are distributed through the Greater Cleveland Food Bank and the county-funded senior meal delivery programs. We want to get the word out. Very important. So that's what I have for today, but please know that we continue to work on ways to help residents and businesses stay safe, healthy, and financially secure as we all navigate this crisis together. Thank you.
Thank you, Executive Beauties. We appreciate your support throughout this. You've been a stalwart supporter of us at the board and in assuring that we have a great response for the community, addressing concerns related to equity based on need, which we think is certainly critical, because we know that there are vulnerable populations that have been disproportionately affected by this, as we've observed directly during this response. I do know that what I also appreciate in coordination with the Emergency Operations Center, not only when we get calls from cases or people we're tracking with contacts, that we also had gotten support to fit test our staff that were working out in the field through the resources through the Emergency Operations Center. Kevin Fries has supported us there, and we appreciate that as well. So it's a great partnership. So we know that we're amidst the Responsible Start Ohio process and returning to work plan. This week, many people began returning to work from different sectors of our economy as we reopen. Under the Responsible Start plan, the state has issued specific mandates for best practices to guide businesses towards safe and healthy outcomes for both their staff and their customers. You can visit coronavirus.ohio.gov to see the complete list. What we're seeing in the state guidance is largely a reflection of what we have been talking about for several weeks. Social distancing guidelines. Again, this is really about physical distancing. We want people to stay socially connected, but that 6-foot distance as a guide is still in place. Hand hygiene, as always, is in place. Face covering requirements, cleaning and disinfecting protocols, all these remain in place. By planning ahead and being deliberate in following the state guidance, business owners can do the best job possible of protecting staff and customers from exposure to COVID. By the end of this month, it's estimated that 95% of our economy will be reopened. While this is a very good sign for our state's financial status, we must be mindful that these safety protocols were put in place for a reason, and that reason hasn't changed. For those among us who feel that the state's mandates are too restrictive or too cumbersome, I remind you that our COVID-19 case counts and sadly deaths are rising in Cuyahoga County. In fact, Ohio saw its largest daily increase in cases since May 8th, just yesterday. We're not out of the woods by any means, and we have a long way to go. We need to think about the fact that now we have more testing that's starting to expand in the community, which will yield inevitably more positive cases. We also know that as people interact, and we do see some leakage around the social distancing guidelines where people are not doing as well as they could with wearing masks, keeping their distance, staying home when they're sick, that also will inevitably result in more cases. So we are planning for that eventuality. We need to recognize that the common good that the public health safety precautions represent, we have a shared responsibility to look out for our neighbor. And in good conscience, we can't place them in harm's way. We know these measures work. So as we reopen Ohio and more people return to work, we must be as cautious as possible to ensure that we keep employees and customers safe so that businesses can stay open and staff can come to work. On behalf of those working in public settings like retail stores and food operations, please do your part to keep them safe. We owe them that debt of gratitude and can show our appreciation by following the guidance. Wearing a face covering, staying at home when you're sick, and keeping your hands clean are signs of respect for the health of others. As you return to work or visit workplaces with high levels of contacts, such as stores or restaurants, remember that your cooperation is an important part of our recovery as a community, as a county, and as a state. Earlier this week, Governor DeWine announced the revision of the Stay Safe at Home order, which required Ohioans to stay at home except to conduct essential tasks. The order has now been replaced by a set of recommendations known as the Ohioans Protecting Ohioans Health Advisory. The advisory recommends but does not require those who are not at high risk to stay at home when possible in order to reduce the spread of COVID-19. People in high-risk categories, like people over 65, and those living with health conditions, chronic conditions, are advised to take extra caution. This would mean staying home as much as possible except to seek medical care or other vital needs. My parents are in that category. They are approaching 80, and my advice to them is to stay put. We are still early in this response. Estimates are that less than 5%, perhaps only 1% to 2% of us have been exposed to this new virus. And so we have a long way to go, and unless and until we have a solid treatment and a vaccine, we're going to continue to see cases, and we will continue to see fatalities. The CDC describes people in high-risk categories as having these issues: chronic kidney disease, chronic lung disease like asthma, diabetes or liver disease, serious heart conditions, or severe obesity. If you have any of these conditions, proceed with caution. Please do your best to limit exposure to large groups of people. Be sure to wear a mask unless you have a medical reason not to. Keep your distance from others. Under the health advisory, the mass gathering limit of 10 people remains in effect. Large groups promote the spread of COVID and many other illnesses among people of any age, so please keep your gatherings to 10 or less. The advisory states that Ohioans should rely on their sense of personal responsibility and accountability when leaving home, and these are words to live by. As we've described in recent updates, we're grateful to the County Executive, Beauties, and Metro Health for their partnership in bringing increased testing capacity to our community. Executive Beauties and County Council have committed resources to test up to 30,000 people in the county, those in high-need areas and in vulnerable communities. The process of selecting testing sites and working with local communities has already begun. And I'll remind you that we've been testing, working with Metro Health from the very beginning, even when testing was scarce, to test in areas where testing was not available and risk was high in the congregate settings. You'll hear more about a recent event that we did for testing in the community from Ramona, Brazil in a bit. Our community testing strategy focuses on several of the groups in Ohio's Priority 2 testing guidelines: residents from long-term care and congregate living facilities, first responders, public health workers, critical infrastructure workers, people 65 or older, people with underlying health conditions, and people of racial and ethnic minority groups with underlying health conditions. Our ability to serve in our communities will be determined using equity-based strategies that prioritize issues such as access, need, and underlying health conditions. We know there are folks that don't have access to health insurance and need a test. They have symptoms and don't know where to turn. These resources are designed to reach them. What this means for the community is that we are moving systematically to help those who need our help. We're proud to be part of this expansion of testing services as we partner with our communities and protect the public's health and well-being. Metro Health released a model, as we know, recently, predicting an increase in coronavirus cases in Cuyahoga County and across the state in late May and early June. Modeling from Dr. Johnny Rose, a preventive medicine physician from Case Western, who was actually the first preventive medicine resident to cycle through the Board of Health some 10 years ago. Dr. Rose has been working on models for quite some time, and his model also is predicting a rise even as the state opens back up for the reasons that we described. Predicting a rise even as the state opens back up, even with the warm weather coming to us that we're all grateful for. The predicted increase is based on Ohioans beginning to interact more as the opening of the state continues, and an increase in testing that will yield more positive cases, with people gathering in bars, restaurants, and stores as well as at their respective workplaces. The model shows a spike in cases. As people come in closer contact and opportunities for transmission increase, social distancing guidelines and wider testing become more important than ever in helping to reduce the spread of the virus. Just a word on Memorial Day before I transition to Dr. Gullett. On Memorial Day, we take a moment to duly honor the brave men and women who have fought and died while serving in the military. I would also ask that you remember that over 95,000 Americans have died from COVID-19 in just the last 2.5 months. For reference, an estimated 58,000 people died during the Vietnam War. Please keep in mind that friends and family have suffered in the wake of all these tragedies, and keep them with you in your hearts during Memorial Day. Please interact with family and friends in responsible ways that honor the public health prevention guidelines that have proven so effective in the COVID response. I'd like to now transition for our data roundup to Dr. Gullett.
Good morning. I'd like to begin by thanking our media partners. Thank you all for being here this morning. And I'd like to thank Paul and Heather for providing interpretation services. We really appreciate all that you continue to do to cover the impact of COVID-19 in our community. You can't see the room here behind the cameras, but everyone is masked and socially distanced. And I know that you all are risking your own lives and risking being out to do this, and we really appreciate your continued sacrifice. I also wanted to begin with some gratitude for our Cuyahoga County Board of Health staff this morning. They have all worked really hard in the last few months doing our regular public health work that we want to ensure is always occurring for our community, but also pivoting into this new response. And so our team has been busy training in roles that they aren't used to doing, and doing it with joy, and doing it because they know that's what our community needs. And so I just want to recognize them publicly. I also want to recognize our sanitarians. I've talked about them before, but they are always in the background doing so much hard work. They are at our drop site with our amazing county partners, ensuring all of that PPE is distributed in an equitable way. They are continuing food service inspections. They're shuttling test kits from place to place. They're picking up test samples and taking them to the lab. So thank you for all that you're doing out and about outside of the walls of the Board of Health. I'm gonna just pause for a moment and allow Heather to reposition and allow the cameras to move over to the data slides before I review all of our data for the week. I'm always impressed at how quickly you pick up those huge cameras and whip them over to the other side of the room. It's very impressive. So for the Cuyahoga County Board of Health jurisdiction, our cases this morning are as follows. Lab confirmed cases, 2,084. Probable cases, 495. Date of illness onset stretches from February 28th to May 18th. And our recovered cases are at 893. The number of identified contacts as of yesterday was 4,423. The age range for our cases is 1 week to 101 years of age, and the median age for cases is 51 years old. Nearly 56% of our cases are female and 44% male. With regard to hospitalizations, at any point during the illness, 415% of our 415 of our cases have been hospitalized, which represents about 17% of our total cases. 414 of those are adult cases, and we have had one pediatric admission. Those represent cases of active virus. They do not represent cases of systemic inflammatory disease in kids, which you have heard about previously. We have not yet had any reports of those cases by hospitals. Our ICU admissions, meaning anyone who needed ICU level care, were 118 cases, and those were all adults, and that represents about 5% of our cases. And all of those 118 are also included in the 415 you see above. This is a new graph this week. We wanted to show you how our cases have risen week to week. We've chosen every Friday since the very beginning of our pandemic here in the community. And this represents in red our total number of cases each week. So you can see the continued rise. I've been living this with our team here from the very beginning. I'm grateful to have had this opportunity, but hadn't taken time to pause and really reflect on the last 10 weeks of our lives. And when I did that this week, and putting these numbers together, I was really surprised, just seeing how much has happened in our community in just a short period of time. You will see beyond the red in the total cases, in green you see our total deaths or the fatalities, which I will review in more detail shortly. And then I'm very pleased to show you the blue, which are the total number of our community members who have recovered from COVID-19. And we're very pleased that that continues to rise. We have 1 to 2 team members every day who solely focus on clearing people who have recovered from the infection. So that's a really important part of our work and something that we want to celebrate with the community and all of these people. Again this week, about 21% of our cases are in healthcare workers. This is pretty stable. Early on it was higher, it was closer to 30%, but in the last few weeks it's been around 21%. And 42% of our cases have pre-existing conditions. Those conditions you heard Terry talk about earlier as making you higher risk for complications from COVID-19. Our cases in racial and ethnic breakdown are shown here, and I also have a graph to show you in a moment. 1% of our cases identify as Asian, just over 38% is Black, nearly 49% is white, 3% is other, and 8.6% unknown. For ethnicity, 2.6% of our cases identify as Hispanic or Latino, 74% as non-Hispanic, and just over 23% still unknown. Our team is working diligently to, again, get this as well as much more information about symptom onset, all the different kinds of symptoms, et cetera. These are the graphs that represent the information I have just shared with you. And we like to present the information in several different ways, which is always posted to our website after this press conference. But this just shows you the racial and ethnic breakdowns of our total cases, which I just reviewed. These are the recovered cases. This is another new analysis that we want to share with you today. 59% of the recovered cases identify as white, 31% as black, 6% is unknown, 3% other, and 1% as Asian. With regard to ethnicity, 80% of those who have recovered identify as non-Hispanic or non-Latino, and 3% as Hispanic or Latino. These are hospitalizations by race. And again, these numbers, as I mention every week, are lower than the numbers I give you at the very beginning of the press conference because those numbers are pooled last night, whereas these numbers have to be pooled a few days ahead because we have to have time for our amazing data team to do analysis. And I really want to give them a huge shout out. They are continuing to do more and more analysis every week, and we're very grateful for that on top of all of their other regular work that they do to support our agency and data. So these hospitalizations show that 48% of our cases that are hospitalized identify as white, 44% is black, 4% is other, and Asian as 2%. You can see the race, the ethnicity data on the bottom. 79% of cases identify as non-Hispanic or non-Latino who are hospitalized, and 4% is Hispanic or Latino. This next slide shows ICU admissions, which is again a subset of the hospital numbers. Our ICU admissions show that 47% of those in the ICU identify as black, 44% is white, 6% is other, 2% is Asian, and with regard to ethnicity, 83% identify as non-Hispanic or non-Latino, and a very small percent as Hispanic or Latino for the ICU admissions. This also represents another look at our healthcare and pre-existing condition data. The top are healthcare workers. They represent, as I mentioned earlier, 21% of our total cases. They represent 10% of those hospitalized and 9% of those in the ICU. So we really want to understand how our healthcare workforce has been affected and impacted by this. The PPE you heard our county executive talk about has been critically important in minimizing the impact on our healthcare employees, but we also know that they continue to be affected to some extent. So we're very grateful for your efforts to protect them. Pre-existing conditions in those who are hospitalized are 72% of the cases have pre-existing conditions. And in the ICU, 79% of people have pre-existing conditions. However, you still see for hospitalizations and for critical care admissions, there still is a percentage of cases that have no pre-existing conditions. Before I move on to talking about deaths or fatality data, the longer this goes on, I think the more almost numb that many of us become to what our new lives have become. But I never want any of us to be numb about loss of life with regard to COVID-19. So I ask that you continue to remember these families, those affected by infection, but those affected by loss. This Memorial Day is particularly going to be hard for these families, so please keep them in your thoughts. We've lost 168 people in our community to COVID-19. 158 of those are from lab-confirmed cases, and 10 are from probable cases. Those individuals had exposure to lab-confirmed cases, but were unable to be tested prior to their deaths. These dates of deaths are March 20th to yesterday, May 21st. So this represents a full 2 months in our community. The age range for these cases continues to expand. We've lost individuals from the ages of 49 to 99 years old, and the median age for loss of individuals in our community is 79 years old. 50% of them have been female, 49% male, and in 1% of cases, we actually haven't reached the family yet and did not want to assume gender or sex identification. Race and ethnicity breakdowns are seen here, and again will be shown in a graph next. Asian, for the deaths, 1.2% of our deaths identify as Asian. Just over 23% is Black. 67% is white. Other is less than 1%. We don't know race in just over 7% of our fatalities. With regard to ethnicity, 1% of our deaths identified is Hispanic or Latino. 84% is non-Hispanic, non-Latino, and in 15% of the cases, we are still needing to obtain that information. This is a graphical representation of what I just shared on percentages. And again, this will be posted so that you can look at it more closely following the press conference. This is our customary slide, which I know you all love. But we're going to use this to again remind us that we're going to talk about this curve, but we're also going to talk about percent utilization and where we are with regard to surge capacity. I'd like to remind you that we have flattened the curve in Ohio thanks to our amazing communities staying home, but that is changing. And we've got to stay vigilant because the potential for surge exists. We have a lot of healthcare resources in this community, but we still have to be very careful about exposures so that we do not overwhelm our healthcare system, particularly as they begin to do other types of healthcare and surgeries that people actually need that have been delayed. This is our epi curve for this week and from the very beginning. You'll notice that we see some ups and downs with regard to confirmed and probable cases. This represents all of the CCBH jurisdiction. We continue to have fairly significant transmission in the community, and this still represents fairly limited testing. We're incredibly grateful for the increased testing we are unrolling, but we still see that we have lots of cases with prioritized testing, meaning not everybody that wants a test can yet get it, and we still see quite a bit of infection. We also see in blue the recovered cases. And you can see this is similar to what I presented earlier, but we wanted to show them in our epi curve overlaid. And as a reminder, the far right of the curve does not represent no more transmission. That represents data that are yet to come in about the last few days. But we are very committed here to giving you the most up-to-date information. So don't take an absence of red in the last few days to mean an absence of cases. It's actually quite the opposite. This is our zip code map for this week and prior, and you'll notice we continue to have more zip codes that are darker green. We're very thankful to our data analyst, Richard Stocklin, who continues to put these together for us week after week. Again, this represents the zip code where cases have identified that they live. This does not represent necessarily where the infection occurred. Finally, I often present to you each week our hospital utilization data. I referenced this earlier in my remarks. This represents the percent of available resources we have in Cuyahoga County. This is cumulative or aggregate, meaning it's all the hospitals together. And again, remember that people come from outside of Cuyahoga County to receive care here. So the usage here does not just represent those who live in our county. For medical and surgical adult beds, we're at 70% utilization, which is unchanged from last week. For pediatric admissions, medical surgical beds, we're at 52%, which is a decrease of 1%. For critical care adult beds, we're at 77%, which is an increase of 5%. And we have slowly seen an increase in the utilization of critical care beds over the last few weeks, which I will show you in the next slide. And our ventilator usage is at 33%, which has increased 1%. And this is with a pretty standard baseline of number of ventilators. So it's not that the number of ventilators is changing, going up and down. It's actually been pretty stable for quite a while. So this represents the change in each of these 4 parameters, and I wanted the public to be able to see this, the capacity we have in our community since the end of March. That's actually when the data became available to us through a state portal. So in blue, you see the percent of adult medical beds. It's been bouncing within a few percentage each week, which I've been giving you, but not a significant increase. We may see changes as people come back for elective surgeries that are allowed to happen if they stay overnight, which has been restricted up until now unless it was an emergency. For pediatric medical beds, you see in orange, there's been a bit of a rise, but it's been stable now for a number of weeks. For critical care adult beds, you can see in gray the rise that I spoke of earlier. This is actually the highest percent utilization of critical care beds we've had in our community since the beginning. And ventilators are in yellow. Back in early April, we had 55% ventilator utilization, which you see there, and we've been pretty much around 30% since then. I do want to really emphasize that our hospitals have surge capacity plans in place. So if we continue to see rises in cases requiring hospitalization, there are abilities to change the number of beds and things like that. But I felt it was important for everyone to sort of see where we are as we begin to reopen and track that information as we have been going forward. The last piece we have been sharing the last few weeks is testing. This only represents 3 hospital labs in our community. This does not represent the private labs that have also contributed to testing of nursing homes and ambulatory practices. The total tests for this week were 22,356 that were reported to us. We just get full reports. We don't have breakdowns of who was tested or the number of people in a certain demographic who were tested. This is compared with the prior week, which was 14,088 tests among those 3 labs. The percent positive this week is 7.1, and that represents the number of tests who were positive compared with the total number of tests that were done. And between the different labs doing these tests, the percent positive ranged from just over 6% to 8.7%. So this just gives you a general idea of the number of tests here. This doesn't, again, represent tests only for people in Cuyahoga County. It just represents that they had a lab in one of the facilities here in the county. And the last slide is just a reminder of the testing priorities. We are still limited in testing despite significant improvement and access thanks to our county executive and his team. We still are focusing on priorities 1, 2, and 3, as are our hospital partners. And so as you hear more from my colleague Ramona, please keep in mind that in public health, we are focused on priority 2, which is focused on congregate living, as well as those who have symptoms and who are over 65 or have underlying conditions. So with that, I'm going to allow Heather a chance to position back, and I will welcome my colleague Ramona to the podium, and thank you very much.
Good morning. First, I would like to again acknowledge all the graduates, including my own son, who's graduating from pre-kindergarten today. He told me he has defeated school. I didn't want to break it to him that he has a little bit longer to go, but for today it's been defeated. It's a reminder that although the ways we've celebrated life's important events have been altered, the achievements are still the same, and there are still great moments to celebrate. So, just moving on, as Terry has discussed, we and Heidi, Dr. Gullett, we are following the state's priority testing guidelines and who we are targeting for testing. We know a lot of focus has been on healthcare workers and long-term facilities, and rightfully so. With funding from the county, supplies from the Ohio Department of Health, and our partnership with Metro Health, we have begun testing in the community. We will continue to focus on groups where infection is likely to spread quickly and with devastating effects, as has been mentioned before, and places where nationally it's been shown that testing may not be accessible, like in communities of color. We have discussed equity as a focus of our COVID-19 response, and a part of ensuring that equity and making sure that we address it is making sure that resources are used intentionally where they have been intentionally or even unintentionally denied. So our first community testing event was yesterday in partnership with the Word Church, as well as the city of Warrensville Heights. Terry, myself, and Dr. Gullett were out there. Yesterday it was nice to be in the sun for a little bit. I found out I'm a much better nurse than traffic director, but that's okay. But one of the things that, from interacting with a lot of the folks who were coming out was just hearing and seeing their expressions of gratitude for the ability to get tested where they had not had that opportunity before. We've talked about before about institutions not being trusted in many communities that have been marginalized. And so part of our community testing strategy will be working with institutions that are trusted. The African American Church is a trusted institution in the community. In many ways, it's served as a place of celebration and joy, and also for a safe place for sorrow and refuge. So we are grateful for that partnership. We've worked with the Word Church in the past during H1N1 times, which seems like so long ago. And also grateful for Pastor Vernon, as well as with the mayor, Brad Sellers, to help us organize that event. We are currently still finalizing the results from that event, but we will be planning more testing opportunities for the community based on data of where we need to go. So a lot of the data that Dr. Gullett has presented will inform the next places that we need to go, and we plan to do that over the summer. So we also want to make sure that people who are going to get tested get the right information about testing. And Dr. Gullett and Terry have already mentioned that general testing is not yet available. To be tested, a person has to have an order through a healthcare provider, so a doctor or a nurse practitioner or physician's assistant. If anyone feels that they may have been exposed to COVID-19 and are having symptoms, we ask that they call their healthcare provider to see if testing is necessary. And people without a healthcare provider can call the Metro Health COVID line at 440-592-6843. People with mild symptoms may be asked to isolate themselves at home and without testing. So testing won't always occur even if people don't feel well, but they can be evaluated to see if testing is necessary. I just want to talk quickly about how testing is done. And there are a variety of ways. Some of what we know right now are better than other ways. The most accurate test that we look at is the nasopharyngeal swab. So this is a long swab that goes far back into the nose. It's then turned and then pulled out. People describe it as uncomfortable but quick. And I just want to reassure people, because there are some myths out there about testing, that people are not being infected while being tested. I would like to stress that very strongly. We work very hard, like Dr. Gullett talked about, with protective equipment, making sure that the person that's doing the swabbing is doing it correctly. We've all worked very hard to try to prevent the spread of COVID-19. Infection does not happen during testing. So after the test is done, then it is sent to the lab, where that tells us whether there is if there's living virus that can be detected. And then a provider will call that person with the test results. So the way we become aware of that is through the labs. So labs then forward positive test results to us, and then that's where our whole contact tracing process begins. So we have also, of course, heard about contact tracing scams, and honestly, it has made contact tracing much more difficult for our staff. So just to kind of review what a staff person would ask for if they call, would be to verify the person's name, their date of birth, their address, and the names and phone numbers of people they have been in contact with. And it also helps if they tell the people they've been in contact with that they've given their information to the health department and to expect a call. A lot of times we call out of the blue and people don't know who they've been around and how do we get their information. So if someone is diagnosed with COVID, if they could let the people they know they've been around that we will be calling, would be helpful, because sometimes people don't really let us get far on the phone before they hang up on us. But as was said earlier, we will never ask for a social security number. We will never ask for bank account information. If someone is concerned that the contact tracing may be a scam, in addition to calling the number given earlier, they can also call the health department to verify that that person works at the health department. And that number is 216-201-2000. Turn it back over to Terry.
Thank you, Ramona. As we wrap up and take some questions, I'm reminded that in public health, we have sort of a mantra that we follow, and that's that access to public health services and access to care is a right and not a privilege. If we look at the data that Dr. Gullett presented, what we know is that in our population, about 60% of our population is white and about 30% of our population is African American. If we look at hospitalizations and we look at ICU, intensive care unit bed numbers for the community, 48% of those that are hospitalized are white and 44% of those are African American. If we talk about ICU beds, 47% of those are occupied for COVID by those that are African American and 44% by those that are white. The access to care issue, delays in seeking care, distrust of systems, all those may have impacts on health outcomes, and those have to be addressed. And this COVID pandemic has illuminated what we've always recognized, that this disparity has existed and continues to exist and has been exacerbated by the COVID pandemic. So with that, I'd like to stop and allow us to take some questions that you may have.
For Dr. Gullett, if we can go back to the recovery numbers, I don't know if we've seen those from the state before, but if you can kind of elaborate on those a little bit and talk about their significance.
Sure. So we've been providing you aggregate or cumulative numbers of those recovered for a few weeks, but we hadn't given you racial and ethnic breakdowns yet because we simply hadn't done that analysis yet. We're doing our best to provide more and more analysis each week. So what we're seeing is that more and more people are recovering from infection, but what all that means is that we think that they are through it and we're clearing them based on symptoms. We do not have enough testing to clear people based on a testing strategy, which is no longer the preferred way to declare someone cleared by the CDC. Earlier that was, but given testing shortages and our understanding of the infection, we no longer use that. So what this represents is the number of people in our community who have had the infection that is either lab confirmed or probable, meaning they've been exposed to a lab confirmed case, developed symptoms, and we treated them as if they had the infection, which we believe they did. And our team actually does a full interview to clear people. So it's called a discontinuation of isolation is the official term. And we go through that interview. We learn more about what their course of illness looked like. We learn more about whether they were hospitalized, whether they'd been in the ICU, and also we learn a little bit more about how they're feeling now. And then we send them a letter. If we think that they meet the criteria for clearing, we send them a letter that allows them to be out of isolation. Because remember, isolation is a legal order of isolation. So they get a letter that says you no longer have to submit to isolation. So that's how the process, and this just represents, the folks who in our community have reached that.
And I guess, have you seen the state numbers, and are we consistent with those? Because I don't believe I've seen those, the state recovery rates and numbers.
I actually have not either, and it's not that they don't exist, I have not looked for them. So I have really only focused on our community numbers. That's something I can certainly look for, Vic, for the future. But I've really been focused on Cuyahoga County with regard to our recovery numbers. We do report it, however, in the state system. So as soon as someone's cleared, we love bins around here. We have so many bins. Every tactics meeting, I find another reason to make a bin. And we have a way that we mark them every day, and our amazing data entry team puts them in the state system as quickly as we clear them. So the state is receiving those as well.
Good, and you're comfortable with those, our recovery rate? I mean, our recovery rate looks like it's where it should be?
Yeah, I mean, I don't really look at it as a rate because everybody recovers differently, and so I'm not really looking at how many have we recovered each day and let's try to get more people recovered, because I really want people to know that they may proceed at a different recovery timeline than other people. It depends on so many factors, like your underlying medical conditions, when you were diagnosed in your illness. I mean, some people have had their illness for a week or two before they ever get tested. They've been staying home, but then they get sicker, end up in the hospital, what have you. So I look at it as progress. We celebrate every single recovery that we have, but I don't necessarily look at it as a rate or a timeline, because I want people to recover when they feel comfortable that they have improved symptoms and that they're safe to return to their normal life outside of isolation. This is about preventing transmission of infection and making sure people have the level of care they need. So that's what we focus on.
You guys talk a little bit about what's been happening in the community over the last week as patio dining has resumed, restaurants have resumed, retail has reopened. Just about the complaints, are you guys pleased with the way things are going?
Yeah, so I'll repeat the question, and then Terry looks like he wants to answer, so I'd be happy to step out of the way. The question is about, as we've seen reopening occur, patios have been, people have gone back to patios to enjoy outside dining. What have the complaints looked like, and how have we addressed those? I can address also another piece of the testing part after Terry, but if you want to talk about enforcement first, and then I'll come back.
So early on, as the orders are, as the information is made available at the state level, we first always go in with the lens to educate first so that people understand what it means. A lot of this has been moving fast and furious. What the governor has said is he does expect that people comply with the guidance to protect the public. The governor made a statement earlier in the week that if folks are thwarting the guidance in these different settings, particularly in restaurants and bars, that their liquor license may be in jeopardy. He made that statement. And so certainly he sees that as a resort that will only be sought if necessary. And similarly, we feel that businesses' first inclination is to try and comply. They may not understand the rules. They may have to make adjustments within the setting, whether it's seating or within their work procedures. We've seen creative use of plexiglass we've seen a whole range of technological solutions people are putting in place to try and comply as best as possible, and then be able to make the dollars to gainfully employ staff and protect staff. So we expect that that will continue. We've seen more use of outdoor settings during the summer for seating to expand seating capacity. But it will be important that people follow the guidance, and we'll work with them. And it is our anticipation that there will be, far and away, most folks, as they have to date, will comply. But in those instances, where we are seeing some challenges, we'll take action necessary to assure that people do comply, because ultimately it's about preventing more cases and saving lives, and we see that as a sacred responsibility that we have.
Have you seen dozens, hundreds, thousands of complaints so far?
Well, so I'll start from the beginning. I mean, to date, we've had on the order of 8,200 complaints. That's since the beginning, really, the last 6 weeks or so. I don't know the last week's numbers. We can report that out. I'll make a point of providing some environmental health numbers next week, and we can give you a sense of what they've been seeing. But I think we're still in this first week, and we need to give folks a chance to comply. And then by the end of the month, we're really going to be basically 95% open. So we'll give you those numbers and report on the types of calls we've been seeing and provide that at the next briefing.
Are you generally comfortable with the compliance, levels of compliance you've seen?
The question is, are we generally comfortable with the levels of compliance we're seeing? I think what we're comfortable is that people are making a good faith effort to comply as they understand the rules. And I think that that's natural whenever anything new comes along, and they've been closed for quite some time. So they've been, now have to stand up their business and organize that business, and it doesn't happen overnight. And we're happy that they're beginning to bring employees back to work to become gainfully employed, and they are honoring their responsibility to protect both patrons and employees alike. I think at this stage, we're comfortable that people are taking those steps to do it, and as we see concerns, as we have from the beginning, we will respond and assure that that compliance is attained. You have a finish up?
I would just add, as a physician, I would be remiss if I didn't say my heart was a bit heavy when I saw pictures on social media of people who were gathering and weren't social distancing, and that's because I've talked to people on the phone and seen from our team and the several thousand interviews we've done how serious and devastating this infection can be. And so I would just like to remind everyone, from a perspective of celebrating our first summer holiday of the season, no one would love this to be over more than our team. We long for the days when we can go back to doing good old boring public health stuff, right? But we can't, and we're gonna be at this a long time. And so I would just like to please remind everyone, if you wanna enjoy the outdoors, enjoy them responsibly. Please try to comply with all that these business owners have tried to put in place. People are really trying to do the right thing, but we need customers as well to do the right thing. So please try to socially distance. Please wear face coverings whenever possible. Please wash your hands a lot. Use sanitizer if you don't have soap and water. Please avoid frequently touched surfaces, and I know a lot of business owners are working hard to keep those clean. I know lots of different kinds of businesses have these amazing plans for cleanliness. If you have a gym that's going to be reopening, please comply with what they're asking you to do. Things are not going to be the same as they were in February, but we need everybody to go along with what our business owners and our leaders in the business sector are doing. So that's the one piece I wanted to add. Confusion with regard to cases and the case definition. And I want to just be really clear that our case definition has not changed. I've given you the case definition every week from the beginning, and it includes people with active infection. Our case definition and our case numbers do not include anybody who only has a positive blood test for antibody to COVID-19 or serology. That came up yesterday, and I wanted to make sure that I made that clear for the community, that We are getting those reports, but those are separately managed, and you are not seeing those included in our numbers here. So people can be confident the numbers you see here are active cases or recent cases, not anything that could have happened sometime in the past. Are there other questions?
Have there been days where there have been more people recovered than new cases?
So the question, Scott's question is, are there days where there are more people recovered than new cases? There were a few weeks ago, and I think you heard Ramona talk about that a few weeks ago, but not recently. We've had quite a few new cases recently.
Has there been
so-
a noticeable uptick?
So we've had increased cases. I think you've seen week to week how many cases we've had, and we do continue to see quite a few lab confirmed cases. If you notice, our probable cases compared to prior weeks are a lot smaller, but we're able to get sick people tested more readily now. So some of this is a reflection of testing, but some of this is also a reflection of more mixing. And so I think the combination of those is leading to the increased cases that we're seeing. We are very hopeful we'll have more recovered cases day by day than we have new infections, but it's going to depend on everyone doing their part as we reopen.
How concerned are you about this weekend, especially with the long weekend and with projected nice weather?
Scott's question is, how concerned am I about this weekend and the projections of nice weather? Well, I am really excited about sun and warmth. It's been a long winter for a lot of reasons. But I am just concerned that people please listen to our guidance. This is, again, not about taking away anyone's individual right to do what they want to do. We just ask you to do it responsibly. So I'm concerned only insofar as people think it's not such a big deal, but I think most people recognize the gravity of the situation and recognize the severity of the infection. And our numbers haven't blown up the way they may have been predicted to early because people followed recommendations, and we need people to continue to do that. Prevention is the best cure for getting us through this.
One more question, please. Okay,
All right.
thank you very much. Appreciate your Executive Beautician and Ramona Brazil and Dr. Gullett for being here. Get out and enjoy the sun, do it safely, do it responsibly, and we'll see you next week. Thank you.
Have a great weekend. Thanks for